ACE Africa addresses problems of high poverty levels, high infection rates from HIV. We give empowering education to community groups. Basically, we focus on the orphan, but the orphan is a product of the society. The number for children affected by HIV in Bungoma is 11% of the population. That is why our engagement with youth groups, we engage them so that as a group they can receive education. That education can be the difference between getting HIV and not getting it. We also have got child-to-child programs within the schools. The child-to-child clubs are styled so that they can encourage children to participate in health by improving their health-seeking behavior. Now, when we go to the household level, you find that most times we are tackling issues to do with lack of food or lack of proper nutrition. So we seek to address that through encouraging kitchen gardens, group gardens, big gardens that they can use to support children who are orphaned within that area. In many cases, the local health facilities would not have medicines or some medical supplies. So we have an arrangement with them whereby we make these supplies, then we send our clients there for proper prescription and to be given the medicine. ACE Africa has been able to reach 56,000, at least in 2009. Most times these children do not know where to go, or they do not have a voice. So we provide that voice. So that is the purpose for which we exist.
I work for Africa Educational Trust, AET for short, in Somaliland. Our organization is an educational organization. Most of the population of this country is illiterate. 80% or 75% of our school-age children are not attending schools. If you compare Somalia or Somaliland with the rest of Africa, we are lagging behind. We try to help by delivering literacy courses and small skill training kind of interventions. We deal with the most disadvantaged groups like IDP people, disabled children, like nomadic children. For the last 10 years, we have been operational in Somaliland. We have enabled more than 100,000 to read and write. Through literacy, you can do a lot of things. It helps you to correct the cycle. So that is our hope.
Challenge Kenya is an organization, a national NGO that was started in 2006 to promote the rights of children and enhance protection of children against violence. What we do is that we run a 24 hours child helpline, which is staffed with counselors.
Thank you for calling Child Helpline.
We receive calls from children from all over the country. In one day, we receive between 500 and 600 recorded calls. About half of those will be counseling cases. We work with different partners, and this is a very critical part of our work. The helpline cannot run effectively without a proper response mechanism, and that requires that we have referral partners who are well aware of what the helpline does, who are committed to child protection and child rights issues like we are. There are different ways that we inform people about the number and the service. Sometimes we run advertisements and press releases and publicize the number. Sometimes we'll do road shows, drive from different towns, distribute materials, have competitions. We have a wheel challenge game, and they will tell us about their knowledge on child rights.
What does a child's right to have say mean?
We deal with a number of children's homes because they are a vital part of our work. And this is because sometimes some children who are in an abusive situation may need to be removed from home and put the child in a place that is safe, that they can continue to receive counseling while a social worker is dealing with their matter or dealing with the parents at home. There are various challenges, but we are happy that at least we are making a difference in the lives of many children in this country.
Home from Home looks after many vulnerable children. Children may have been orphaned, abandoned, neglected, and they are referred to Home from Home, and then we place them in our various foster homes. Daily we get telephone calls to look after children that may have been abused or left alone. And frequently we get children that have come into our care, sometimes very, very sick. One little boy came down from the Eastern Cape, which is quite a long way from Cape Town. He was dying, very, very sick, and he was placed in with one of our foster mothers, and now he's a bubbly, lively, wonderful 17-year-old. And there are many more stories of children that need help and that we're able to look after. One of the biggest challenges facing Home from Home is finding the right foster mothers. Finding somebody who can really care for the children and will look after them as if they're own. Obviously we need the financial resources to set up the home and run the homes, but we also need the staff and the right people to make sure, because the most important thing we can offer the children is love and very good care and safety. We do believe very strongly that the model of care we're providing is a very good alternative for children. It's hugely important that children are safe and brought up in as normal a home as possible. So I think that's it, just keep trying to provide the best care we can for vulnerable children.